Scott Edingham. Thanks for joining us here in the unique Northwest. Can you imagine for a second if 1% of the people you know or 1% of the people in your town just died? Like, what does that look and feel like in your head? Well, for those in Tonasket, Washington, and Okanogan County, they don't have to imagine that because that just happened at a nursing home facility of people who died from COVID-19. And here to talk about some of the sad situation is Correspondent Anna King. Thanks for joining us today, Anna.
Thanks for having me, Scott.
So on this unfortunate story, you've been making a lot of calls and finding out just what happened. So as we tape this, we should talk about the numbers that are here in time. Those could change, of course, as the days go on. So what numbers are we talking about here? And we should just say, these numbers are people. They are more than just data points. So we want to remember that, of course. But what happened there in Tonasket?
Of course, Scott. Each of these families has families and colleagues and people that know them, and the scale of it is really unsettling. So far in Tonasket, 32 residents have come ill with COVID-19. 20 staff members, which is about half of the total staff in the facility, have also been sickened with COVID-19. And 12 people have died so far. That's as of yesterday's numbers. The first person was asymptomatic that they found in a test that was a routine test earlier in November. And then by the time the test came back, many people were showing symptoms, as how it was described to me. And then the deaths started happening rapidly over the Thanksgiving weekend. It was just a weekend of terror as one person after another passed away from COVID-19. They said that the facility is actually quite, in normal times, is quite renowned for keeping their residents alive into their very elder years. So many of their population is in their 90s. And so this is an ultra vulnerable population of people to have this happen to.
Anna, the first known cluster of coronavirus deaths in the U.S. was happening in the Puget Sound region in nursing facilities there. There's this sort of infamous case there at a place called the Life Care Center in Kirkland, Washington. And since then, of course, it seems to have, creeped out into smaller areas, into more rural areas. I wonder if you got a sense of talking with various facilities and healthcare officials around the region that they thought, well, at one time this was sort of a city problem and we were sort of far removed from it. And now it's sort of hitting closer to home, if you will.
Yeah, Scott, the health officials that I'm talking to said, yes, the disease maybe was delayed by a month or several weeks in coming to their community. But once it took root, it's really hard to get out of these smaller communities. And they're really having a hard time translating the urgency now, a year later, a year into this pandemic, of we still need to, yes, you're tired, but we still need to isolate. We still need to wear masks. We still need to not see your friends. We still need to be careful at the grocery store. These messages are just getting old and worn out, even though it's still very urgent as a situation. And now these rural systems are at the breaking point. A health system CEO I interviewed just about an hour ago, Scott, said in the Wenatchee area, he expects all hospitals in Washington to be full and have to turn people away later this month. And he said, if you have a heart attack or if you have a stroke, there might not be a bed for you if you walk into a hospital in about 2 weeks. It's just a very dire situation all across the rural landscape of the Northwest.
The other side of this, of course, as you mentioned, are public health officials who are largely carrying out a lot of this work at the state and county level. And on another story you reported recently, a lot of those public officials are becoming burnt out. They're leaving their jobs. They're thinking about leaving their jobs. Some have been fired for other reasons, things like that. And I wonder if you could talk about some of the things that you heard from them and some of the numbers that we're talking about of county public health officials leaving, including there in Okanogan County, where this outbreak occurred in Tonasket.
You know, everyone I have talked to so far is just dog tired. They've been fighting this pandemic since winter. They still don't have enough PPE or testing equipment. They still don't have enough staff. One person I talked to, a health director out of Moses Lake, said she's had a posting for months for a contact tracer, and they just can't fill that position. Some of the staff are quitting because they're too exhausted, they're too tired of fighting, and they just are burnt out and tired. And now they have to pick up for perhaps some of the hardest part of the fight that they've had all year, just in advance of possibly getting some vaccines into the community.
Well, it's good information on a tough but important subject. Thanks for reporting on it, Anna.
Thanks for having me, Scott.
And for more on the coronavirus front as it relates to data and contact tracing, we turn to correspondent Tom Banse. Thanks for joining us today, Tom.
Pleasure to be with you.
So, Tom, that phrase, contact tracing, is probably one that not a lot of people would be familiar with before this year, but a lot of people are, of course, now. And there's some news on the contact tracing front, or as it relates to exposure and letting people know whether they've been exposed. What is this news from the state of Washington?
Yeah, this is an interesting and potentially important development that pretty much everyone who wants to can participate in and possibly help their own cause and safety. Washington state has joined at least 15 other states around the country, most of them further back east, in launching a smartphone-based notification app for when you've potentially been exposed to someone who was contagious with COVID-19. This is a voluntary download for people, and what it does is, monitors when other phone users who've likewise opted in are near you for more, under the usual guidelines, more than 15 minutes, closer than 6 feet away. And it keeps an anonymous log on your phone, and if someone in your circle of close contacts then later tests positive for COVID-19, they punch a code in the app, and you get a confidential notice that someone in your circle of contacts, doesn't say who, tested positive, and you should probably get tested yourself and self-quarantine.
All right, so let's do a quick walkthrough here. Got the phone in hand. This is for people, of course, who have iPhones and Android phones, which are most people who own smartphones at this point. Walk us through. How do we get it on our phone?
It actually is pretty easy. I put it on to see what it would be like, and actually hoping it might be useful, although I don't really want a notification in this case, if I can help it. iPhones have it built in now with the latest operating system, so it took me less than a minute. You open settings, scroll down to find exposure notifications, select the United States, then Washington State. It's coming soon to Oregon, not yet to Idaho, and check off a few boxes and you're good to go. Android phone users have to download an app from the Google Play Store. Actually, it's not that hard either. It's free, called WA Notifies, what you search for, install, select a few boxes, and you're off to the races.
That's all well and good. I think the obvious question that a lot of people will have, well, what's going on with my data? Who's tracking me? Who can see me? That's a question that a lot of people have in this day and age with all of the different apps and online things that we use. What's some of the privacy settings here?
Very important question. Probably the biggest question on a lot of people's minds is the government tracking me now? I've talked to a couple of privacy experts who are actually pretty impressed by the privacy protections in this app. It, as we said, does log when you're near other users. Those log notations happen over Bluetooth, though. It's not a GPS location tracking, so it's just a proximity monitor. There is no sharing of that information with government. This will happen kind of in the background with apps that Google and Apple jointly developed. If you get a notice, you won't learn who that person was because, as we said, no real names are being saved. and you won't know the location where you were potentially exposed either. Just someone who was infectious in the last 14 days that you were near might have exposed you.
Interesting. I will be checking it out myself on my own phone as soon as this is over. Another term besides contact tracing that people have probably heard more of this year, especially in some of your reporting, excess deaths. That sounds sort of stale, but as it relates to COVID-19 and tracking its effects in the Northwest, what is going on with excess deaths?
Yeah, and this is kind of a dark side of the coronavirus pandemic that we don't hear that much about, because you probably, like I, wake up most mornings in the newscast and you hear about the COVID death toll or how many new infections in the past day were confirmed. But the epidemiologists and even insurance folks who need to know how many people might die each year, they can get a pretty good guess from looking at the past average of the past 3 years, how many people should pass away here in 2020 under normal circumstances. This year is not normal. There's way higher death toll, which is what we call the excess deaths, 3,300 through October in Washington State, 1,100 or so through October in Idaho. A good percentage of those are the COVID deaths, but there are hundreds of other people who've passed away in our region above the number you would normally expect. And what I was curious about is what kind of collateral damage, what are the causes for that? And some of it may be undiagnosed COVID cases, or COVID just being the last straw that pushed somebody over the edge to an early grave, and the death certificate says, the underlying issue was heart disease or Alzheimer's, and it's not recorded as a COVID death.
And last here, this isn't really a COVID story, although maybe it kind of is. Boeing is big business in Washington State, one of the largest private employers, of course. And a huge story before the pandemic was the 737 MAX being grounded after 2 air disasters globally. None of those planes were flying. That was a huge hit for Boeing's bottom line. Many people were wondering how they were going to dig themselves out of that huge budget hit. And recently, the 737 MAX was cleared for takeoff, if you will. That story, frankly, sort of, flew under the radar. Do you think that it was really a much bigger story, and in any other year that would have been a huge story and we just sort of missed it?
Boeing has for decades been Washington State's largest employer, and the combination of the downturn in the airline industry and this extended grounding of the best-selling plane that Boeing has to offer for commercial airlines has probably knocked Boeing into place number 2 now, and allowed Amazon to overtake it as the biggest employer in Washington State this year. But hopefully for Boeing, from Boeing's point of view, they've turned the corner now that the US and subsequent countries around the world are clearing the Boeing 737 MAX to take back to the skies. There are hundreds of these grounded airliners, both at Moses Lake Airport and at several Puget Sound area airports that now need to be checked out, not only by Boeing technicians, but by the customer who's going to take delivery and the FAA. I mean, each of these are going to be gone over by a fine-tooth comb for days on end. So there's going to be work from the ungrounding of the Boeing 737 for folks in Washington State, probably well into 2022.
Well, it's good information and good to talk with you, Tom. Thanks for being here.
Thank you.
See more coronavirus news and all of our Northwest coverage at our website, nwpb.org. Thank you for joining us here in the unique Northwest.